Alrighty, this is the manual muscle test for the deltoid, the middle deltoid to be exact. This test, the arm is going to be at 90 degrees, abduction, hand placement, 3, 2, 1. That's a grade 5. You also can have the arm in scaption, same hand placement, 3, 2, 1. That is a grade 5, and the origin of the middle deltoid is at the acromion process, and the insertion is at the deltoid tuberosity, and the action of this is to abduct the glenohumeral joint. This is a manual muscle test for the quadriceps. And here, straight up, 15 degrees down, 3, 2, 1. And that is a grade of a 5. In the quadriceps, the vastus intermedius is the middle muscle, and it has an origin of the anterior femur with an insertion of the superior border of the patella and the tibial tuberosity, and its action is knee extension. This is the manual muscle test for the rectus abdominis. The rectus abdominis has an origin of the pubic crest and the pubic symphysis, and its insertion is the xiphoid process and the cartilage of the ribs 5 through 7, and its action is that it flexes the trunk. So for the test, your subject, hand behind the head, is going to go into a crunch position, and to get a 5, we're going to try to get the scaps off of the table, or in this case, the bar. So go ahead. And the scaps are not nearly off completely, so I'd give this a grade of a 4. This is the range of motion test for knee extension. For knee extension, the normal range is 0 degrees. So here's my homemade goniometer, and we're gonna check it. And that is a range of 0 degrees, so it is normal. This is the range of motion test for shoulder flexion. Alrighty, you ready to go into flexion slowly? Thank you. There we go. And then that looks like it is at 180 degrees, and 180 degrees is the normal range. This is the range of motion test for cervical side bending. We're going to start with the legs shoulder width apart, and then we're going to place the axis on S2 and then palpate. And then once we start at 0 degrees here, she's going to begin her side bend. Alrighty. And her side bend came out to about 28 degrees, and 25 is the normal range of motion for this test. Thank you for watching my demonstration of kinesiology skills. My name is Chaney Martin, and this is for EXS-335L.